Let's begin with Chapter 17, Stimulants. To start, let's review a little bit of A and P in the nervous system. The nervous system is composed of all the nervous tissue within the body, everything from the brain, spinal cord, nerves, and ganglia. The purpose of the nervous system is to receive stimuli and transmit information to the nerve centers. There are two types of nervous systems. There's the central nervous system and the peripheral nervous system. The central nervous system is composed of the brain and the spinal cord, and it regulates body function. Stimulation of the CNS might either increase nerve cell neuronal activity or block nerve activity. The peripheral nervous system, on the other hand, is composed of everything beyond the central nervous system and consists of two parts, the somatic nervous system and the autonomic nervous system. The somatic nervous system is voluntary. These are the muscles and things that you can control. Your finger movements, your arm movements, your leg movements, your head movements. On the other hand, the autonomic nervous system is things you can't control, such as your heart rate or kidney function. There are a few different areas where we would use stimulants medically. Most commonly, you'll hear of ADHD, such as things like Ritalin and Adderall. It's also used for patients with narcolepsy or the reversal of respiratory distress. It's going to have three general categories: amphetamines, analeptics, and caffeine, or anorexians. In the case of attention deficit hyperactivity disorder, this is a dysregulation of the transmitters within the brain, such as serotonin, norepinephrine, and dopamine. It usually occurs in children before the ages of 7 and is most common in boys. Characteristics include inattentiveness, inability to concentrate, restlessness, hyperactivity, impulsivity, and an inability to complete tasks, along with poor coordination. On the other hand, narcolepsy is characterized by falling asleep during normal waking activities. Most dangerously, activities like driving or cooking that can pose a serious safety hazard to the patient. This would also fall under the category with sleep paralysis. This usually accompanies narcolepsy and affects the voluntary muscles. A patient with narcolepsy is unable to move and may collapse. They're unable to move, their body's still asleep while the mind is awake. But first, we'll talk about amphetamine actions. These stimulate the release of norepinephrine and dopamine, while blocking the reuptake of norepinephrine and dopamine, further increasing their levels within the brain. This causes euphoria and also increased alertness, but it does have side effects like dizziness, headache, tachycardia, palpitations, hypertension, nervousness, restlessness, irritability, and even anorexia, dry mouth, weight loss. You're going to see when we start getting into our ADHD meds what emphasis it is on making sure that the patient has eaten breakfast before they take their ADHD medication, because that stimulant will wipe out their appetite. You're also going to see checking the patient, giving the patient a nutritional assessment, getting a daily food diary, checking their weight regularly, making sure that they're eating and not losing weight while we treat their ADHD. Some common medical forms of amphetamines are methylphenidate, used to increase attention span and cognitive performance. Or there could be dexmethylphenidate, decreases impulsiveness, hyperactivity, and restlessness. The dosage should be minimal in controlling ADHD symptoms. And finally, modafinil. This increases wakefulness in patients with sleep disorders. You're also going to see a common NCLEX ATI question of avoiding caffeine while taking methylphenidate, taking any of these stimulants, and that we don't want to have two stimulants combined. Caffeine may increase the effects, but it also increases the effects of oral anticoagulants, barbiturates, anticonvulsants, tricyclic antidepressants, and MAOIs. The side effects, again, tachycardia, palpitations, hypertension, anorexia, dry mouth, diarrhea, weight loss, and even seizures. Anorections, on the other hand, cause stimulant effects on the hypothalamic and limbic areas of the brain to suppress appetite. And these should not be given to children under 12. Side effects include restlessness, euphoria, insomnia, tachycardia, palpitations, hypertension, seizures, and erectile dysfunction. Analeptics. Caffeine is probably one of the most used drugs across the country. Well, it is the most used drug across the country. And people look at coffee as benign, but it is a drug. Can be used in neonatal apnea. Both of my daughters are in the NICU, and both would receive caffeine to prevent apnea as soon as their breathing would start to slow. Side effects include headache, withdrawal, palpitations, tachycardia, insomnia, tremors, restlessness. In the case of methylphenidate, we want to assess the patient's vital signs carefully, making sure that we have a baseline for future comparison. We're going to keep a close eye out for hypertension, and we're also going to assess the patient. Is this medication effective? Has their attention span increased? Are they behaving in a more calm manner? We're going to place a heavy emphasis on making sure the patient either takes the drug right before a meal or after their breakfast because we do not want to wipe out their appetite. We want to make sure that they're still keeping their nutrition up. We're also going to advise them to avoid foods that contain caffeine, report a regular heartbeat, record height, weight, and growth for children, avoid any alcohol and caffeine, and use sugarless gum to relieve dry mouth. We're also going to make sure that they do not stop abruptly, but they taper off to avoid any withdrawal symptoms. For our first practice question, what would indicate to the nurse that the child is taking methylphenidate requires more teaching? That be A, the child is seen drinking a cola product. B, the child checks his weight twice a week. C, the child takes the drug 45 minutes before a meal. Or the child takes the drug before breakfast and lunch. And that answer is going to be A. The child is seen drinking a cola product, as we never want to combine caffeine with another of these stimulants. For question two, a child has been diagnosed with attention deficit hyperactivity disorder. Which drug does the nurse anticipate the healthcare provider will prescribe? That be A, zolmitriptan, B, doxapram, C, bensphetamine, or D, methylphenidate? And that answer is obviously D, methylphenidate, the drug we've been talking about. Methylphenidate should not be taken by patients with a history of which condition? Renal failure, glaucoma, hypothyroidism, or heart disease? And that answer is going to be D, heart disease, as this stimulant is going to force the heart to work harder. And for our final question, when providing teaching to a group of parents regarding attention deficit hyperactivity disorder, which information will the nurse include? That'd be A, children with ADHD have low intelligence. B, children with ADHD have an infection in their spinal fluid. C, EEG results are typically normal in children with ADHD. Or D, learning disabilities are often present in a child who has ADHD. And that answer is going to be D. Learning disabilities are often present in the child who has ADHD. Now, to say that they're less intelligent, there's many extremely intelligent people with ADHD out there. It's just, especially in younger years, many of them can struggle through school. They lack that attention. They're very impulsive. But anyway, that's all we got for this chapter. I'll see you in the next slides.